My name is Andres Vasquez. I'm an interventional cardiologist. I've been working in the field now for some time. My areas of expertise include coronary interventions, which pretty much are stents and angioplasty done to the heart arteries, heart-related procedures including closure of holes in between the upper chambers of a heart. It's called atrial septal defects, stenting and interventions to the other arteries of body, including the carotid arteries, the leg arteries, the kidney arteries. In addition to that, I am board certified not only in interventional cardiology and general cardiology and internal medicine, but also in echocardiography and nuclear cardiology.
My name is Jerry, and I'm 69 years old. I did not know that I had an aortic aneurysm until I came to see Dr. Bala. I had been with other cardiologists, and this was after having a quadruple bypass 7 years ago. Everything I thought was well. I began to feel tired, constantly give out, so my primary physician sent me to see Dr. Bala. We began to run some tests. He said this, what I was feeling wasn't normal. We ran CAT scans. The original CAT scan was to be sure that I didn't have anything that would affect the treatment that he was going to do. And then he came back and gave me the good news was that I had no existing cancer or anything that would avoid that, prohibit us from doing the other procedure, but I did have an aortic aneurysm. So that was a year and a little over a year ago that was first diagnosed.
So abdominal aortic aneurysm is a disease affecting the main artery of the body. It's called the aorta, at the level of the abdomen. Many times it affects the part of a aorta that's below the kidney arteries, and what an aneurysm means is an increase in the artery size, usually over twice as big as the normal diameter for the artery. So as it gets bigger, there's a risk that it can rupture, and that has a very high risk of death if it happens. So what we want to do is we want to detect the patients that are at risk for such an event beforehand and treat it before anything bad happens to them. So there are general guidelines to screen, as you're asking. Males that are smokers, pretty much more than 100 cigarettes throughout their lifetime, even if they're not active smokers anymore, if they've done that, and are between 65 and 75 years of age, should undergo one-time screening for abdominal aortic aneurysm. We provide that service to try and identify those patients that are a potential risk for this and treat them appropriately. In addition to that, some patients have a family history of certain genetic conditions that predispose them to have this, and those patients and family members should definitely undergo a discussion regarding screening and the implications related to that.
When we first got the news, we researched all of it. He went through the procedures with me. We initially, at that time, the original CAT scan showed it to be 4.2 centimeters in width and 5.8 long. And they discussed all the procedures with me, the surgery, some new things that were possible to do, but due to the size of it. And I talked with him, I talked to my surgeon. We decided that we would monitor it because as it stayed in that range, surgery may not be the way to go immediately. I really didn't want to do the surgery. I just had a mental deal about the surgery after trying to gain as much knowledge as I could. So we did, and we continued to monitor it over this last year, and it went along and only grew just a tiny bit, and then the last time we were doing it in 3-month intervals, The last time it went from 5.2 to 6.5. And when it gets to the 6 point or above, then it gets to be a critical situation, so I'm told. And they suggested and recommended that we do the sleeve type deal. And that's what we did. And I didn't have to go through the surgery, which that was a blessing, and I'm extremely pleased because
Jerry is a wonderful human being. We've been provided with an opportunity to help with his care, and we've been lucky to help him out. He presented with an abdominal aortic aneurysm below the kidney arteries that was growing over time. So we were monitoring it very closely, and as it continued to expand to significant size, then we decided it was time to proceed with repair for the aneurysm, given the fact that the size was such that if we didn't do something, then his risk of spontaneous rupture was now starting to climb to concerning levels. So what we did was close his aneurysm with a special technique that nowadays we have. Before, the only option for repair of an aneurysm was open repair, meaning open surgery, which it has some implications, including a high risk of death, major bleeding, and major complications, heart attack, strokes. The newer alternatives are not fit for every type of aneurysm. It depends on the anatomical characteristics specific for every particular patient and the patient characteristics, but Jerry was such a patient that he would benefit from the closure through catheters. That's called endovascular closure of an aneurysm, of an abdominal aortic aneurysm. And we use a special device that's smaller than the average device we currently have available in the market, which limits the size of the artery holes we had to do. We went through both our arteries in the groin under moderate sedation and local anesthesia. We put a couple of stitches on each side at the beginning of a procedure. Before doing the whole procedure, we're successfully able to close the aneurysm with catheters, and we then sutured those little arteriotomy holes in both groins. He recovered real well, and the next day he was home.
The post-op period was actually very good. The procedure was done that afternoon. I stayed overnight in the hospital. They went through both groins on each side, and actually there was no problems at all. In fact, the next afternoon I was out and going, and I never missed any. I missed 1 day and a half of work. I have animals and barns and horses, and so I actually went out and started doing my barn stuff that particular day. I fed all the horses, went in that night, got up the next day. I never stopped from that time on. I kept doing what I'd normally done. I didn't do any lifting, like I didn't lift anything heavy. But as far as moving and getting around, and I started, actually it'd be the second day. I came home the next morning after the surgery, and then that afternoon I did my normal task. The following day I just went back to doing everything.
Well, most of the process happens here actually. We provide very close relationship and service to our patients. They follow up with us as needed. And when we have a patient such as Jerry that has an aneurysm, we know we need to surveil or follow it up very closely. There are guidelines on how to do this, but that may require some imaging of the aorta as the aneurysm continues to expand, as frequently as every 3 months, as unfrequently as every year. and it depends on the size and the rate of growth of the aneurysm and the patient's symptoms. So most of the surveillance was done in the clinic. We were able to monitor him very closely, and as we noticed that things were growing to the point where there was an indication for repair, we went ahead and proceeded with that. And he's been followed here since. One very important thing with closing an aneurysm with catheters as opposed to open surgery is that patients need to be willing to follow up with serial imaging studies like ultrasound or CAT scans over time to avoid any issues with complications down the road. One unique complication to closing the aneurysm with catheters as opposed to surgery is that there can be movement of the device that is used to close or leakage around the sealing sites for the device, and that requires very close follow-up. It's extremely uncommon for those things to happen, but it's our priority to make sure that Jerry and every one of our patients that we take care of here after a procedure has a continued follow-up and good care, and we identify any potential problems that may arise in the future for him.
I would highly recommend Dr. Bala and Dr. Vasquez and everyone involved at Orion, because they kept me in the know of everything that was going on. They informed me of everything, and more especially they kept our family involved and told them everything. They were there. I've never tried to get a hold of either of the guys or anyone at the office that I didn't get an immediate response. And it's very unusual this day and time for your doctor or your surgeon, either one, more especially those two guys. I had their cell phones. They made sure I knew how to get a hold of them anytime I needed it. And I didn't have to, but just the fact they did it was just another deal that built my confidence and helped my whole ideas and thoughts about this situation.